The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.
Hello and welcome to the ASCO Guidelines podcast series. My name is Shannon McKernan, and today I'm interviewing Dr. Narayam Ramakrishna from Orlando Health UF Health Cancer Center, lead author on recommendations for disease management for patients with advanced human epidermal growth factor receptor 2 positive breast cancer and brain metastases, American Society of Clinical Oncology Clinical Practice Guideline Update. Thank you for being here today, Dr. Ramakrishna.
Thank you, Shannon.
So what is the importance of creating guidelines in this area and for this specific patient population?
Well, we initially set out to create guidelines for management of brain metastatic disease in HER2 positive patients because this represents a very interesting subset of the breast cancer population. They develop brain metastatic disease at a higher rate, 12% overall, and in up to 50% of those with metastatic cancer. And the management of brain metastatic disease in the past has been viewed as a one-size-fits-all approach, but increasingly we're learning that the management of brain metastases has to have a disease-specific approach, and that was the purpose of creating guidelines for the HER2-positive breast cancer population.
And can you give us a general overview of what this guideline covers?
Yes. This guideline basically encapsulates our key recommendations to guide appropriate therapy for this patient group. And therapy includes local therapy such as surgery, radiosurgery, and different forms of focal radiation treatment, whole brain therapy, systemic therapy, and supportive care for patients with brain metastases. And we've stratified the different recommendations based on the prognosis of the patient, whether it's favorable or unfavorable, by the number of metastases, single versus 2 to 4 versus extensive diffuse disease or leptomeningeal disease. And also looked at how we would differentiate management for patients with progressive systemic disease versus controlled systemic disease.
And what are the key recommendations of this guideline?
The key recommendations, again, are to tailor the combination of local treatment and systemic treatment based on some of these factors that I've mentioned. For patients with single metastases or limited, which we define as 2 to 4 metastases, then we choose between local therapy approaches, including surgery plus post-op radiation treatment, or radiosurgery with or without whole brain treatment, depending on the size of the metastases, resectability, symptoms, and need for tissue diagnosis. For patients with diffuse or extensive disease or symptomatic leptomeningeal disease and favorable prognosis, we recommend whole brain radiation treatment. One of the key recommendations for patients whose systemic disease is not progressive at the time of brain metastasis diagnosis is that the systemic therapy should not be switched, and this is to emphasize the importance of optimal systemic and extracranial disease management. On the other hand, if systemic disease is progressive at the time of brain metastasis diagnosis, then HER2 targeted therapy should be offered according to the algorithms for treatment of HER2 positive metastatic breast cancer, as are discussed in the accompanying guideline. And while there should be a low threshold for performing a diagnostic brain MRI in the setting of neurologic symptoms of any kind, routine surveillance in patients without a history of brain metastases or any associated symptoms is not recommended.
So since these guideline recommendations are consistent with the 2014 version, this signals that there's a lack of practice-changing data in this area. So how does that help inform future research in this topic area?
Yes, we found it very interesting that despite significant developments in the area of systemic therapy, HER2-directed therapy, over the intervening 4 years, there was not data which could substantively change our consensus guidelines. I think there's intense research and interest now in other systemic therapies which have potential for activity against HER2-positive brain metastatic disease, and also in studies of factors which modulate the rate of appearance of brain metastatic disease in this HER2-positive patient population.
So finally, how will these guideline recommendations affect patients?
Well, I think that these guideline recommendations are very important for patient care. And the reason is that they've created awareness among clinicians of the importance for a disease-specific management approach for this population and, by analogy, for other disease-specific brain metastasis groups. HER2-positive breast cancer brain metastasis patients are a very challenging patient population with complex issues relating to systemic disease management and to brain metastasis management. And there is considerable interest in how we can optimally manage their systemic disease while managing and alleviating the effects of their brain metastatic disease. I think these guidelines help to guide clinicians in providing optimal management for this challenging group of patients.
Great. Thank you so much for your insights on this guideline, and thank you for your time today, Dr. Ramakrishna.
Thanks very much, Shannon.
And thank you to all of our listeners for tuning into the ASCO Guidelines podcast series. If you've enjoyed what you've heard today, please rate and review the podcast and refer the show to a colleague.